Warm greetings to you all. My name is Tony Fauci, and I am the director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health and a member of the White House Coronavirus Task Force. It is my pleasure to welcome you to the annual conference of the International Leadership Foundation, which this year is being held virtually with hundreds of people from across the country. As you know, this meeting honors Asian Pacific American leaders from all walks of life for their efforts to better our nation and their communities. I also want to take this opportunity to congratulate the 2020 ILF Civic Fellows who are taking part in the Leadership Development Program that fosters community leaders of tomorrow. As we continue to confront the unprecedented global pandemic of COVID-19, I am keenly aware how profoundly it has upended the lives of virtually everyone. However, it has become clear that we all must adapt to this situation, as you have done so well, and unite to overcome its many challenges. In this regard, I am deeply grateful to the hundreds of thousands of Asian Pacific Americans on the front lines of the United States response to COVID-19, including those working in the healthcare industry. In addition, I would like to thank the Asian Pacific American organizations that collectively contributed more than $31 million to acquire 10 million pieces of medical protective equipment and donate them to hospitals and emergency responders across the nation, a powerful example of American generosity in times of need. This donation of essential resources greatly aided our efforts to fight the pandemic, especially in the extremely difficult early months of March, April, and May. Here in the United States, the COVID-19 pandemic remains a serious problem. A staggering number of lives have been lost, and many more who have recovered from the coronavirus infection suffer debilitating after effects. Americans initially came together and successfully flattened the curve, which enabled hospitals to survive the surge of infections at the beginning of the pandemic. Subsequently, however, several areas of our country began reopening in an accelerated fashion, or had citizenry that ignored guidelines before those areas had reduced the pool of infected people to a low enough level that community transmission of the virus could easily be brought under control through the containment measures of identification, isolation, and contact tracing. Consequently, certain parts of the country are now struggling with alarming resurgences in cases. Our country is large and heterogeneous, and thus solutions must be tailored locally. However, heterogeneity does not mean we are not intimately interconnected. What goes on in one area of the country ultimately could affect other areas. I am hopeful that with the guidance provided by our states, cities, and communities, and the sustained discipline required of us all, we will, as a nation, gain the upper hand over this pandemic. Now is not the time for complacency, however. Rather, we must intensify our efforts, since our job is certainly not done. We also must remain vigilant in the face of future uncertainties. We do not know how the pandemic may further evolve or what its ultimate impact will be, especially as we head into the fall and winter seasons and the return of seasonal influenza. Our country's return to some form of normality will be neither fast nor easy. However, we can be encouraged by looking at what has happened in states such as New York and Massachusetts, which reduced community transmission of the coronavirus from very high to very low levels using the public health tools we have in hand. Public health endeavors are the pathway to economically reopening our country, not the obstacle to reopening. Heartening progress also is being made on the scientific front, and I anticipate this will become more apparent in the months to come. Large-scale efficacy trials of several promising COVID-19 vaccine candidates developed in record time are starting to be launched. And although one can never guarantee success in vaccine development, I am cautiously optimistic that we will have a vaccine by early 2021. A website we recently launched to recruit people into clinical trials, which testing candidate vaccines and other prevention strategies has already attracted more than 100,000 willing volunteers. Clinical trials of multiple different types of treatments, including monoclonal antibodies, convalescent plasma, and hyperimmune globulin, may yield results even sooner. Unquestionably, we in the United States are at a critical moment in our response to COVID-19. Now is the time for us to dig deep, double down, and adhere to the simple practices we know work to protect ourselves and others until we have medical tools proven to safely and effectively prevent and treat this disease. Wash your hands, avoid crowds, wear a face covering, and physically distance. Together, we can do this. We can end this terrible scourge. And so, stay well and be safe. We are all in this together. And the only way this will end is by each of us choosing to be part of the solution. Thank you again for your personal efforts and generous donations that have made a difference in protecting and sustaining our frontline workers as they do their jobs to care for and protect us all. Thank you.